Today we are going to talk about hyperlipidemia, and we are interviewing Emily and Melissa to explain more on this topic. Melissa, what is hyperlipidemia?
Hyperlipidemia is when high LDL bad cholesterol builds up in your arteries and acts as a waxy substance and causes blockages in blood flow, which can be very dangerous and can cause various other health problems.
Okay, Emily, what population are affected by hyperlipidemia?
Well, some people can be born with it even when their parents are healthy and they're born as healthy infants as well. But most people that have hyperlipidemia are men aged 45 and older and women aged 55 and older, because often healthy lifestyles become less healthy as we age. People with close relatives who have had early heart disease also have an increased risk of getting hyperlipidemia.
Okay, what are the symptoms of hyperlipidemia?
Hyperlipidemia shows no symptoms on its own, but when it's paired with other illnesses, symptoms can be present. So for example, when paired with hypertriglyceridemia, patients can find pimple-like lesions all over their body, and pancreatitis is also a common side effect, which is when your pancreas swells. Long-lasting hyperlipidemia can lead to cardiovascular disease, heart attacks, strokes, and atherosclerosis, which is the hardening of the arteries. When hyperlipidemia is inherited, or patients who have already had high cholesterol, deposits of cholesterol called xanthomas can be found under the skin, usually under eyes or in frequently used joints.
That's interesting. How do the doctors diagnose the hyperlipidemia?
Hyperlipidemia is usually discovered during tests for atherosclerotic cardiovascular disease. So often blood tests are used to test levels of cholesterol and triglycerides in the bloodstream. But there are no symptoms that make it obvious to the doctor that a patient has hyperlipidemia.
Okay. Melissa, what are the reasons for hyperlipidemia?
Well, since hyperlipidemia is caused by an excess of cholesterol buildup, it's the main cause of it is by eating high-fat foods and foods that have high levels of cholesterol, and foods such as red meat, full-fat dairy products like whole milk and ice cream can cause or contain a lot of high cholesterol. Also, saturated fats found in animal products such as dairy and eggs and other meats, and as well as trans fats found in commercially and processed baked goods and crackers and cookies.
Okay, also, how we can treat hyperlipidemia?
There are multiple ways to treat hyperlipidemia, but the Mayo Clinic suggests that the change of lifestyle is the most effective. So this includes an increase in exercise and changing your diet to be more healthy. And this can be done by eating monounsaturated fats such as olive oil and avocados and peanuts, completely eliminating trans fats and saturated fats. And this means limiting your intake of organ meats, whole milk products, and egg yolks. Also, eating more whole grain helps, such as whole wheat bread and other whole wheat products. Eating lots of fruits and veggies is helpful because they don't contain any fat or cholesterol. Also, as a replacement for protein products, eating fish such as cod, tuna, halibut, and salmon are good alternatives because they don't contain cholesterol and they contain high levels of omega-3 fatty acids. Also, limiting alcohol intake is a big component because it helps weight management, which can also contribute to high cholesterol levels. And other than change in lifestyles, there are a number of drugs that can also help reduce cholesterol. And two of the main ones are statin, which reduces the risk for cardiovascular disease, and fibrate, which is used to treat high cholesterol in general.
Okay, is hyperlipidemia a permanent or temporary condition?
Hyperlipidemia is definitely not permanent because it can be reversed by a change in lifestyle.
Is it curable or uncurable?
It's curable because you can eat through the change in lifestyle and using drugs such as statin and fibrates.
Okay. What are the health risks if someone didn't treat the hyperlipidemia?
If you did not go to the doctor and figure out what kind of lifestyle changes were best for you, it can be very dangerous to your health because since cholesterol blocks the blood flow in your arteries, it can limit the blood supply to your heart, which causes coronary heart disease and eventually leads to a heart attack, which is obviously not a good thing. A similar thing can happen to your brain. The cholesterol can clog up arteries that lead to your brain and which causes a stroke. So that's not good either.
And now,
We're going to look at the different alternatives you can use to help reduce your risk for hyperlipidemia.
so we're here at our local deli, and we just looked at the breakfast sandwiches that are available that you can get with whole eggs or egg whites. For someone wanting to reduce their risk of hyperlipidemia and maintain a healthy lifestyle, the egg white sandwich would be a much better alternative as opposed to the whole egg, which has the yolk and higher cholesterol levels.
So one of the major causes of hyperlipidemia is in high-fat milk products. So now we're going to compare two different types of milk, 2% and non-fat. So this is 2% milk, and it contains 20 milligrams of cholesterol, which is 7% of a 2,000 calorie diet. And fat-free milk or skim milk contains 5 milligrams of cholesterol, which contributes to 1% of your daily cholesterol intake based on a 2,000 calorie diet. So it's clear that if you're trying to reduce your daily cholesterol intake, skim milk is clearly the right choice.
Actually, no. So,
To contribute to an overall healthy lifestyle, it's important to fill up on as many fruits and vegetables as possible.
Fruits and vegetables have no cholesterol in them and contribute to good fiber levels in the body and lots of energy as well.